Hi everyone, welcome to this presentation. My name is Linus Johansson. I work as a data scientist at Tenfifty, and today I thought I would walk you through one of our projects. So this is a project that we have been working on in collaboration with Concede and regional cancer centers. And regional cancer centers are responsible for something called Min Vårdplan, or My Care Plan. This is a digital support tool, and one big part of this is that cancer patients can go on here and find information about their treatments, potential side effects, and other relevant topics. So, of course, two patients with different diagnoses will find different content on here. And one aim of regional cancer centers is that there should exist diagnosis-specific content for every cancer type. So in this project, we tried to create a solution that would help them create new content in a more time-efficient and consistent way without losing quality. So when I say that we generate this content, we generate a document really. And I will refer to this as Min Vårdplan, but it's only the content that goes into this digital support tool. And it's typically something around 200 to 300 pages of text, and it contains information for patients. So why generate this? First of all, it's very time-consuming to produce, and on top of that, it requires time from people that don't have a lot of time. So medical professionals can have a hard time setting aside time. And the third reason is that it's a better use of their competence if they can review some initial draft rather than having to serve as writers. All right, so before I start talking about the generation, I thought we would discuss what type of reference documents we use. So what type of documents do we use to ground the model's knowledge? In this case, we will have every new Min Vårdplan will have its own set of reference documents. So if we are generating one for liver cancer, for example, then the reference documents will be specific to that. And this is chosen by the group that is responsible for that specific diagnosis. We typically have something called National Clinical Care Programs, and these are especially important because it's explicitly said that Min Vårdplan should depend on this content. But we also allow them to upload supplementary documents, so the group that is responsible can upload any sort of documents they want. So given that we have these documents, how do we feed them into a model? There are two main ways, right? We can either go with long context, so trying to push all the documents into the prompt, or going with the RAG approach, so trying to fetch only the relevant parts for the current generation task. In our case, we have relevant information by design, and we realized quite early that we would need very good retrieval accuracy for a RAG approach to work. So we went with the long context route, and this is something that also Anthropic recommends if you have around 500 to 600 pages of material. And it worked very well for us in this use case, and we didn't have to spend a lot of time tweaking the RAG approach. Something we do, however, before we just push it into the prompt is that we compress the documents by summarizing them. So basically, we chunk the documents up, and we summarize these chunks. And this has two main benefits, I would say. First of all, we get less input tokens. And another thing we realized was that sometimes the model would sometimes mirror the language used in the reference documents. So our reference documents are typically aimed at medical professionals, whereas we want our output to be to patients. So by simplifying the language a bit in the reference documents, we were able to get more simplified language in the final output as well. And given that we have a way of putting all of these documents into a model, we need to choose on some model. This is livebench.ai, They basically evaluate models on various metrics. And in this specific case, I filtered by instruction following average. So how well does a model follow instructions, basically? This is something that's very important in our use case. And you can see that the best performing one is Gemini 2.0 Flash. And this was also the one that worked the best for us. But we did also experiment a lot with GPT-4o, for example. But just choosing the best model on some benchmark might not be the best idea. You, of course, need to evaluate it on your own task. And then you have other considerations as well. For example, does your model support context caching? If you're using long context, you probably want the model to support context caching. Otherwise, it can get expensive if you use an API, for example. Should you have a large language model or a large reasoning model, this will be task dependent. So you may have to use different ones for different tasks. And then what is the context length and what is the cost and speed of using that model? I think when designing these types of systems, you should try to make the system model agnostic. So it should be easy to switch model without it being too big of a deal. Because there will come a time, of course, when there is a better model available. So then it's nice to be able to switch. OK, so for the generation, just to circle back a bit, this is what a mean Vårdplan, the content of a mean Vårdplan looks like. It's structured into 3 levels. So we have modules, which basically act as chapters. Then we have sections, which act as subchapters. And then finally, inside here, we have these informational texts that we call steps. The modules and sections are static across all existing mean Vårdplan. So when we are generating a new one, we know that we will have the same modules and the same sections. What we need to do is to generate these steps. And so what is a step? This is the informational text that is aimed at the patient. It should be a self-contained text, so someone should not have to read the entire document to understand this single step. For this reason, it's also OK if multiple steps include similar information. This is fine by design. It, of course, needs to be correct. It should be easy for a patient to understand. And this is very important, that it's easy for someone to understand. And it should follow some writing guidelines. However, we already have a lot of steps produced for previous mean Vårdplan. So we also have something we call shared steps. A shared step is a previously written or created step that can be relevant to multiple diagnoses. So one example is a step that concerns the care in Sweden. That is a step that is relevant to all diagnoses. And another type is a step that concerns inheritance. That is a step that will be relevant only to cancer types that have some component of inheritance. So these can either be optional or mandatory. Either they should always be included, and sometimes they should be optionally included. So for our generation approach, we realized that you can't just generate a 300-page document in one go. So we take a top-to-bottom approach. We start by generating the outline first, so basically all the headings. And once we have this outline complete, we start generating the actual text content. So for generating headings, I have a somewhat confusing illustration, but we try to split it up into multiple tasks. And for example, this is in the module treatments. And one way of finding relevant headings in this module would be to basically look into the reference documents and find all possible treatments that are within some constraint. So basically doing some needles in a haystack problem. Then we also have a lot of domain logic built in. But one example is that if we include a certain treatment, then we also need to include some side effects that always will be relevant. And then we have these shared steps. So in this case, we basically can iterate over this collection. We can see if it's a mandatory one, we obviously include it. If it's an optional one, then we need to classify if this step is relevant to the cancer type we are generating for or not. So basically, with the headings, we split it up into multiple tasks. So once we have all of these headings, we need to take care of the text. So for these shared steps, they have already been written before, but they do need to be adjusted for the current diagnosis. For this, we take a two-step approach. So we start by letting the model criticize and suggest adjustments. And then based on this feedback, we generate patches. For this, we use a large reasoning model, and the patches typically look something like this. We have some deletions and some additions. Then we have these diagnosis-specific steps. In this case, we have generated a heading, but we don't have any text yet. So these can be quite tricky to write. And if you were to sit down and write one today, I think you would need very specific instructions because it's not obvious how they should be written. We also want them to be structured in a certain way. And we also want some XML formatting so that we later can export these. And then I say that the text itself is not complicated. What I mean by that is that if you give a model an example of such a text, and you ask it to generate a similar text, but for another diagnosis and for another heading, then it will do OK, but it won't be perfect. So when we started this project, we did a few generations, and we sent these to regional cancer centers, and they came with feedback. So given that you get a lot of feedback on a generation task, what can you do with the feedback? A very simple thing to do is to simply incorporate this feedback into the prompt. And this is something that actually worked very well for us. Just basically working in a iterative feedback way. So we would improve on something, send it back to them, and they would come with feedback back to us, and we would basically improve in this way. So few-shotting with very detailed instructioning worked very well. Some upsides to this is that you don't add any unnecessary complexity. I mean, it's quite simple. You can just tweak the prompts, basically. And if you have multiple ones, you would tweak multiple prompts. And we don't need to do anything more advanced, for example, fine-tuning or self-iterative refinement or anything like that. The downsides, however, are that you need to tweak the prompt. That can be a very boring job, to be honest. And it also doesn't make for very interesting slides at a presentation like this. But it worked very well. I think there's usually a quite high ceiling when it comes to what you can get out from simply improving upon your prompt. I think there's a lot to squeeze out there in most cases. And this is actually one that we generated, and those red markings are what was changed before this was actually published. So I think we got it very good from just keeping this kind of simple approach. So some conclusions from this project, basically. I think it's a good idea to try to transfer as much logic as possible to code. So I think it's a common mistake that you try to get the model to do a lot of things, and it may not necessarily have to do all of these things. Sometimes you can just do some tasks before, or you can simplify the task by doing something in your code, or I think there are a lot of cases, at least, when we are tasking the models with too much when we could simply have done it ourselves. Then I thought we could take some inspiration from software development. So functions should do one thing, they should do it well, they should do it only. I think this in some way also applies to large language model tasks. So instead of having them do multiple things, I think it's a good idea to split your task up. And you can, for example, have multiple calls and then aggregate the results at the end, or you can have multiple chained calls instead. This worked very well for us, at least. And then I just have this final note that few-shot works very well, and try a lot of examples. So maybe these first two you try aren't good, and then you can switch the examples up, basically. However, I do think these are only conclusions from how we implemented it, basically. And in this case, I think the actual interesting thing in this case is the application rather than our implementation of it. So how well does something like this work? We have so far we have generated one min Vårdplan that has actually gone to publication. And the initial comments we got on that one was that it took them 2 days to do something that would have taken them months, typically, in calendar time. So I think that's awesome, basically. And yeah, I think it's awesome that so much time can be spent by doing something relatively simple like this. Thank you very much, and also a big thank you to David and Bernard, who has done a lot of the work in this project.
Thank you so much, Linus. This is such a great way to actually end the day, something so directly useful. Are there any questions from the audience?
I think, yeah.
Perfect. We see a hand here. Thank you so much to the volunteers for running around all day.
Yes.
Yeah.
I was wondering if you could share with us like part of the process you used when choosing a model that worked better for you, and also the prompt. Like, obviously you had to spend time like developing prompt that perform better, right? So how do you evaluate and then use that as part of your feedback loop in order to improve your prompt and also choosing a model that is more appropriate?
That's a very good point. I think we had a somewhat, what can you call it, poor way of evaluating, basically. But how we actually evaluated was that initially we would look at these texts and we would see if they are good. Then we would send them forward to regional cancer centers, and they would look at them that have a lot more domain knowledge. And then in the end, they would send them further to doctors and nurses who have even more knowledge. So in some sense, it gets more expensive the further we have to go. And so that was how we evaluated, basically. We didn't do any proper evaluation in that sense. And in terms of including it into the prompt, I don't have an example of a prompt right here, right now, but I think there are a lot of ways you could incorporate it. You could either just say that this was the feedback on a previously written text, don't do that mistake again, or something like that. I mean, I think these models are quite capable nowadays, so they can follow these instructions very well, I would say.
Thank you very much. Do we have another question? Yes, we do.
Yeah, thank you very much for the presentation. I have a question, because you said you create a version and then you do quality assurance with the medical staff or the doctors.
Yeah.
Okay. But then you also said you simplify the language for the patient. So are they involved in looking at that as well, or how do you make sure that the clinical information isn't getting lost in the translation or the simplification?
I think that's two different things. So what we did was to simplify the language in the reference documents that went into the model for the generation task. But you're asking how we didn't lose any medical information in the finally generated one.
Maybe I misunderstood, but I was thinking that you did the first round of creating the model, or the output of the model, and then it was simplified. But you're saying you did the simplification before you...
Yeah, that was in the reference documents, basically. That was fed into the prompt.
Oh, okay. All right. Thank you.
Thank you.
And we have time for one last question, if anybody has one. And it's a very brave thing to ask the last question of the day. Now, no pressure. But it needs to be glorious. Okay, nobody's going to ask now.
I don't know if it's glorious enough. But so you said you reviewed the results with the staff. So do you see any trend that the reviewing time is reducing every time you generate new Vårdplans?
That group that
like the effort to review it, is that reducing with time as you generate improved Vårdplans?
Yeah, or I'm not exactly sure. We haven't really measured the time it takes them typically, but I mean, when they started from a draft, it took them 2 days rather than months of, not of course full-time work, but of various meetings. So I'm not sure how much every single review was improved in time.
Yeah. Okay. And related to the previous question, I was wondering, how do you make sure that this critical info is not lost from the source documents when you simplify them?
They are also they are always reviewed, of course. So we're not, or okay, just so I'm making sure I get it right. Are we talking about the information that goes into the model or out of the model?
Into the model from the simplified source
Yeah,
document.
okay, that's a good question. That's a very good question. I don't think we actually don't do any quality control of that, but I mean, when you simplify or when you summarize these like small chunks, it typically gets it right. I have yet to see any fault from that, to be honest. And yeah, I don't think we need to doubt the models that much that we can't let them do a simple simplification task, basically.
Okay, thank you.
Thank you.
Thank you so much, Linus. This has been really a great final talk. Please accept some flowers from us.
Thank you. Thanks.